all of us certainly were sickened and quite disturbed about the terrible, terrible crisis that happened in Connecticut on Friday. The killing of innocent people, 20 children, 6 adults was beyond our thought pattern couldn't even go there. It was so horrific. I think we have to take something out of this, though, and from every tragedy you have to take something to work on. One of it is certainly taking a look at school security in general. And it's not to run to put in legislation to mandate things, but I think they have to know. I can tell you for a fact that there are many schools in Lakewood that I've had the honor to go and speak in front of that the doors are open all the time. And you're right, it takes some money to put in a camera and a buzzing system and to make sure doors are locked and secured, but I think we have to do that. In certain other schools, young men are allowed to walk around after class with no security sense in that. And I think every school, even though we have been doing that through Homeland Security, even though we've been doing it through our local police departments, has to take a second look and to see how they protect their children, our greatest asset, our children, to make sure they're safe while they're in school and that people that wish to do them harm don't have easy access at all to our school system. That's one thing I think. The second thing we really have to look at is the mental health system, and that's really been a sore point with me because I sit on the board of a mental health hospital. We have shortchanged mental health dollars for years. We have systematically closed our facilities in the state, Arthur Brisbane in Allaire, Marlborough Mental Health Hospital up in Monmouth County, and have shipped our problems out of state, and now we bring them back in state. When they closed these facilities, they said, don't worry about it, the money's going to follow these problems into the communities, there'll be money there for help in the communities. It never happened. That's why, for example, the largest screening unit, the PES unit at the hospital in the entire state of New Jersey is in Kimball Medical Center in Lakewood, because many of the former Marlborough patients reside in the boarding homes around here, and therefore have pushed Kimball to be that #1 unit. Think about it, #1 unit in this whole state of New Jersey. Secondly, as you've even seen in New York, they're closing facilities now. If we take a look at, there's some questions that will have to be answered in the future about what happened in Connecticut, but I never heard any comments from any child study team that worked with this animal, that's all you can call this animal, when he was in high school. You didn't hear a psychologist coming up and say, yes, he was my patient during school and I worked with him, and that's why we recommended he be homeschooled. Or we didn't see that the school system had someone saying, yes, when he was being homeschooled, we came into the home and worked with him. So there has to be some kind of breakdown with that. We have to be realistic that troubled youth have to be identified early and have to have help. And that help has to come through the school system when they're identified and follow them into adulthood. And then when the time comes that they leave the school system, there has to be a secondary area that's dealing with them. Certainly we heard that the entertainment that his mother, the bonding him and his mother had, were shooting guns. There's got to be something wrong with that the bonding that you have with a special needs child is shooting guns. And therefore, where did that fit in? And was that the right area to be involved in? And everything else that goes along with that. And you heard that she said to someone when she had lunch with or breakfast on a regular basis, that she couldn't even leave her child alone with a babysitter for a minute, that the babysitter couldn't even go to the bathroom. I mean, there's obviously problems here. There's obviously they were not identified properly. How do we stop these things from happening in the future? And I don't know if legislation is the answer, but I think maybe funding mental health dollars is the answer, to make sure that schools have that capability of identifying young people that have problems, working with the families, working with those young people through their school years and then after their school years. So I think that's where we have to turn to identify that. I think we have to also look as a state how we're dealing with seriously ill people. And secondly, where those dollars are going. If you're going to close institutions, are those dollars going to the towns, to the counties where those individuals now live? They're not. And we're seeing that being shortchanged. So I think we have to take a hard look how we're spending mental health dollars both on the local level, on the state level, and on the federal level.